Yeah, yeah. So, hello guys. This is Ankush Sharma, and I am one of the great friend of Mr. Kunal. And actually, I'm a physiotherapist by profession, and I live in Chandigarh these days. And rest is all about Kunal. So
That's
yeah,
great question. And you and me are friends for such a long time. We did a lot of
yeah,
conversation. But on Skype, we are doing first time these type of conversation, like recording session.
yeah. Exactly. You are
I'm
right. It's our
having
first
one more
conversation.
question. I'm having one more question before we proceed further. Like, tell me about your profession, Like, as you said, you are a physiotherapist. Like, what type of therapy do you do?
So physiotherapy or physical therapy or physical therapist or physiotherapist, basically these are same things. So
Mm-hmm.
as a physiotherapist, we treat people by physical medicine. So what does that it mean? It means like treating a patient without
Mm-hmm.
prescribing any medicine, without chemicals, treating uh,
Mm-hmm.
him as physical by physical exercises, by physical modalities. Could be sometimes we use physical machines, ultrasound waves, and sometimes electric current as well. And apart from it, sometimes cryotherapy means cold therapy, sometimes heat therapy, and so there are many options. And we also prescribe orthotic device mobility aids to the patients who are not able to walk, and we strengthen their muscles. So physiotherapists also work in association with sports team as well. We assess and make diagnosis, and accordingly we treat patients. So that's
One,
physiotherapy in a nutshell.
one more question. Have you ever been like, have you ever helped any person, like sports person?
Sorry.
Have you ever helped any sports person in that type of
Yeah,
situation?
yeah, yeah, exactly. Not on the sports field, but I have helped many sports person when they used to come to the clinic, which
Okay.
from where like I used to practice when I was in my third year. So
Mm-hmm.
it was a clinic of our college itself. It was an OPD basically. So there
Mm-hmm.
used to be an athlete who used to come there, and I am the one who used to treat him, and he was a runner. So I helped
Okay.
him. I said him strengthening some muscles that can
Mm-hmm.
actually prevent the further injury. So he
Okay.
has
Go.
always complaining pain in groin region. Sorry, groin is the region nearby thigh or thigh region.
Okay.
You can say groin or thigh.
Okay.
So yeah, I helped him get away from his pain, and
Mm-hmm.
yeah, he was all right after 3 or 4 sessions.
As you have maybe read about it, in sports, like related to muscles, what type of I can say like injuries we normally get
Yeah.
in sports,
So bas
like can
in
be cured by you can say physiotherapist.
Yeah, exactly. So it's a good question. So every type of injuries can be assessed. Even the
Mm.
concussion is known as head injury. So head injury is
Okay.
very common in contact sports, suppose like football, rugby, or even cricket. You
Go.
would have heard about the incident of hitting cricket ball on head. So
Okay.
it's a kind of very emergency condition, and we need to just rush towards the field, towards the player, and assess him that whether he's feeling all right. Like there are some criteria to assess whether his mental state is all right, or he needs some emergency treatment or not. So concussion is
Okay.
the common. Another injuries include joint, ligament injuries, knee, ACL injuries. So
Okay.
very common like sports injuries are assessed and treated by physical therapists.
Mm-hmm.
Yeah.
Good. And I heard mostly like what type of generally sports person get cramps.
Cramps, yeah. So
Yeah.
cramps, it's a chemical phenomenon basically, a kind of
Okay.
biochemical phenomena, I would say.
Mm,
Basically, when you do uh, an exercise or a kind of sports activity, and you
mhm,
weren't actually warmed up enough to get ready your body for that specific activity, and
mhm,
you just perform it, you just you rush towards the field, and you just, without warming up, you just give your 100% strength, apply the strength, and then
mhm.
this problem occur. It basically due to the accumulation of lactic acid inside your muscles that gives us
Mhm.
cramps. And cramps is not a serious condition. It resolves on its own somehow, and sometimes we need to stretch that muscle and
Exactly.
do a proper warm up.
Yeah, it's better to do always warm up to
Yeah,
prevent serious injuries.
even
And
serious injuries.
I have experienced one more thing I would like to share with you. You know, before doing any sports activities, if we don't do before warm up, so I can say, I can't give myself 100%.
Okay, not if you don't warm up,
Yeah, so
you
I
can't.
don't do such certain exercise activities and in a not good way as well.
Yeah, you actually, that's correct. I think
Yeah.
you can't, and you shouldn't even do try to do if you aren't warm up properly. And different type of bodies need different duration of warm up. Suppose you are not an athlete, and
Mhm.
you need some lesser duration of warm up. You might need around 10 minutes of warm up, because
Yeah.
you yeah, 10 minutes is enough for you. But if someone is athlete, someone having more muscle mass, and he's a good athlete since 1 or 2 years, he's been practicing, so he needs more warm up, extra warm
And
up he need.
it can be maybe they have to do some particular exercise, so that require much more effort. So they have to put much more effort for warm up as well.
Yeah, exactly. So warm up,
Mhm.
particular exercises means like their joints need to warm up. Simply warm up means warm up, like just giving
Mhm.
that heat to the body, and preparing heart muscle and every muscle for the activity we are going to perform. So it decrease our chances of injury.
Exactly. And I would like to share that thing with you. Like I tried once time, like generally I can do 10 pull-ups easily without no much burden. So
Mhm.
I tried, without warm up, is it much more harder for me. And if I do warm up, I can say I can do more than 10 and easily without putting much effort. Cause I feel much more active, go getter after doing warm up.
Yeah, certainly you would feel better if you have properly warmed up, because
Exactly.
metabolic activities will increase in your body. Your body will get itself ready for the activity you are going to perform. So definitely
Yeah.
you are going to perform better.
I read physical education like 4 years, like ninth to till 12th. And that is a great subject. Get to know about a lot of things related to physical, like these type of injuries and how can we prevent them. Yeah, so these type of a lot of things I have learned at that time.
Yeah, definitely physical education is the foundation, I would say. And I would say like physical education was also one of the subjects that motivated me to go for physical therapy. So yeah,
Exactly. So I'm having one more question. Like before your intermediate level education as like 12, before that you have physical education subject at that time.
yeah, I had physical education during my +1 and +2. I had physical education.
Okay, so what type of chapters do you like from physical education most? Like what's your
Uh,
interest at that?
So I I used to like the entire subject, but the specific subjects, the specific chapters, if you say like those related to the sports persons and sports equipments, and even like sports, like those related to specifically to sports, I would say like physical
Exactly.
education. Yeah. So
Mhm.
these things I really admired a lot.
Exactly. And if you want to know about me, which chapters I like most at that time, related to
Yeah.
yoga. Like there are a lot of chapters related to yoga in every single class, ninth, 10th, 11th, 12th, like whole time there is a chapters available related to yoga, different asanas, pranayama, breathing exercises.
Yeah. Exactly.
Yeah. And apart from that, I have learned, how to do first aid. Yeah.
Oh,
Like,
yeah, exactly.
you these general things, I think every person should know about like first aid and these type of
Mm,
things. So help it in
exactly.
any
There are,
city.
yeah, for first aid as well, there are special techniques that you should learn. I think everyone should learn. Because of the lack of knowledge, many people suffer in our society. Just because, we don't have the sources of, we have actually sources of education, but we never want to educate ourselves.
Mhm.
Everyone should know, I think, uh, CPR. CPR is cardiopulmonary resuscitation.
Mhm.
You would have seen someone compressing chest uh,
Exactly.
if someone lose consciousness, and he's not actually having the pulse in his
Mhm.
artery. So here you can palpate this artery. It's the carotid artery over here. Yeah, you can palpate it, and it will just if you palpate, like you would notice that there is a the artery is just like filling with blood, and it's just rhythmically giving
Okay.
you movement you can feel on your fingers. So yeah,
Exactly.
you can actually
Yes,
palpate it.
that type of feeling can we feel here as we put our like hand, thumb on, you can say, our forehand veins
Yeah, exactly. these are
on
these
wrist,
are
say wrist when we put our fingers on wrist, like the
on wrist
same.
as well.
Okay,
Yeah,
we feel here.
yeah, these are comparatively like feeling
Okay,
the. Yeah.
generally, if you have to do a, like I can say, vote, or you can say you can be a education minister of India.
Okay. Yeah.
Yeah. And at that time, you ask to choose a one subject that should be like compulsory part of education. You can say which part you would like to go with to make it a curriculum and why.
uh I would say like we have already burdened our students with extra curricular active. First of all, there is a need to cut down the syllabus. We have too much of syllabus, which isn't actually relevant for the courses or for the studies we are actually aiming for. So cutting down is the best, and adding some like moral subjects, also moral science, so kind of general science, or also the business subject should be taught to the children since they were child, like when they cross like 9th, 10th, plus one, plus two. In these classes, there should be a concept of money management, financial management, and these subjects, like, and first aid, as I would say,
Okay,
like first aid as well.
one more condition I am adding you here. You have mentioned really great subject, which should be, I can say, essential, necessary to
Yeah,
do
thank
the
you, bro.
holistic growth of a student child. And condition one more here is that according to you, like one, like utmost, which one you would choose here? Utmost
Okay,
important one
utmost
subject.
important is definitely the first aid. Yeah, and if we I have tendency, if some we see someone getting unconscious in front of us, we usually just become apprehensive that what is happening to the person, and he might like we might also get that disease or whatever, because we have lack of knowledge, and we got frightened when we see such people. So educating about these general things is very essential, I would say, even to
Exactly.
children.
You have a
Yeah,
point. Would you like to ask me this one question from my side? I
yeah,
would love.
sure, sure, bro. I would like to ask the same question, please.
Obviously, obviously, I would go with physical education, and why? There is a reason behind it. Cause I think so. We can hit like two birds with one stone. And how? Cause when we are having physical education is a subject. It's not like that you have to like sit at your like in class and do the study, theoretical work, done it. No, it's nothing like that. Half is I can say your like practical work, and like half is your theoretical work. Then it's become like whole.
Yeah, exactly.
And this
You are
way,
absolutely right.
and in this way, as nowadays everything is getting online, and we have to depend on online resources. So nowadays there are so many less chances of like doing mobility to become agile, active. Yeah, but when we
For
have
sure.
this subjects subject, we have to do some certain activity, like we have to perform, and this will be counted as our marks, like in our
Yeah,
CC, like in CC these marks will be counted, as so I can say in this way student will be much more interested about like they can like do fit their body like in their school time, and they can enjoy their life easily, and they can stay away from disease as well, and they can do their study in a much better way.
definitely. Your mentioned point is very powerful, as like exercises and their importance is uh, underestimated in our education system. It's very essential to incorporate some physical activity so that
Mhm.
children could learn that what's their important. And yeah,
Uh, there is a one type of campaign or movement is initiated by Honorable PM Narendra Modi, Khelo India.
yeah, Hello India
Yeah,
Youth Games. Yeah,
yeah, exactly.
exactly.
This type of should be, give incentive.
Yeah, and you would have seen like when these games or youth games, whatever you mentioned, like when they were started, nobody at the time was willing to accept that these could actually uh, increase the standard of Indian performance at the international games. But these
Mhm.
actually produced a very great results. Our teams are now competent. Even if you talk about teams that Indian sports are not known for, suppose basketball and volleyball as well, and even football as well. Our teams are still competent now. Now, current teams are still better than previous ones.
Exactly. That's a great point.
Yeah, bro. And so,
Mhm.
what type of sports do you like?
What type of sports I do like? I like really badminton.
Badminton, yeah, definitely. I think it's one of the best sport because there is a negligible or minimal chances of injuries while you play non-contact sports such as badminton, and it's also a kind of pretty like pleasurable while playing.
It and the best thing about badminton playing, it requires mobility. You have to move a lot, like from here to there.
Yeah, it's a great exercises.
Yeah. Cause like what do we call that thing? Like shuttle. Like shuttle sometime here. So we have to move like hit with the rocket.
Yeah, currently I've just like been to the park, and after before having my dinner, I was playing the same sport.
Okay. Really?
Yeah, really.
That that's great coincidence. We are talking today as well about this one sport. And what do you think, like this, you can say exercise, what type of kind exercise do you like most, according to you?
Exercise, I do. So there is a trend of calisthenic exercise which doesn't require any type of equipment. It's simply
Mhm.
you have, if you have a kind of road, or if you are in a park, you can perform all of these exercises. And first of
Exactly.
all, it has been speculated that we need to intensify the exercise and cut down the duration. And suppose 10 minutes daily exercise, and we can expect ourselves feel fit. But that isn't the case. I would suggest, person should like do exercise with proper calm and technique, not rush and just intensify, because in long term that could hurt.
Exactly. Like I have heard from a thing, you can say elder people as well, as you are also belong to Haryana, me too also Haryana. Maybe you have heard
Yeah.
that thing. You know, in younger time, like those who goes to like like wrestling, like what do we say here? Akhada means like where
Yeah.
they do this type of
Arena.
performs at
Mhm.
arena
Ring.
activities. So, you know, in sometime they do a lot of exercise, and I have heard, you know, when they become oldie, so these gives them pain after some time when they starting to getting age. So that is becoming their life is, you know, hard little bit.
Yeah, you said like uh in upcoming years, like when they reach in their 40s, 50s,
Yeah,
you mean
because
to
you know
say?
they do more than enough because their competition require. That is the reason.
Yeah, definitely. Your
As
your
you
mentioned point.
as you have heard about that one statement as well. Excess of everything is bad.
Definitely, excess of everything is bad. And
Mm-hmm.
uh, in like I would say like excess and intensity are like different things.
So,
Repetition is always, I would say, like if you are repeating, suppose you are lifting 5 kg weight, and 5 kg you are comfortable lifting 5 kg in your arm, you can repeat it like, if even if you are repeating suppose 500 repetition per day of biceps, biceps curls, simply like
exactly.
putting the weight into the hands and like this. So
Mm.
these will not going to have much impact on your health. But if you are lifting heavy weight and you are doing like with so much intensity, giving yourself very few breaks, then I would say like it is going to definitely going to create a problem for future. Yeah.
Well, maybe as we have generally see that thing, what is going on nowadays, there is a
Bro, there is a, yeah, connectivity issue. Can you repeat your last statement?
yeah, sure. You know, nowadays there is a trend, and trend is that like going to gym and lifting a lot of heavy weight without you can say having experience. Yeah, that's the reason. Just a minute.
Yeah, exactly, bro.
I beg your pardon, there is a call coming suddenly.
Okay, so
Yeah. Where were we talking about? I was talking about, you know, lifting heavy weights without any prior experience. So nowadays they are seeing shorts on YouTube, TikTok, and these, and they get different type of injuries. And maybe, if I'm not wrong, you have put it on your status as well. A type of injury, completely different injury a person got. like lifting weight, because he don't have experience and he want to do in a different way.
Yeah. First of all, you mentioned a good point. I appreciate like you mentioned like visualization, what we receive, the stimulation from Instagram, from these
Yeah, yeah.
influencers, so-called influencers, social media influencers. So our youth, those are actually naive towards the gym. Those who don't have proper knowledge. Even when I first went to the gym, I
Mhm.
didn't have enough knowledge about these things. But later on,
Okay.
when I continue to like gain experience and read, then I came to know many things. And even today, like I'm still learning. So
Mhm.
yeah, I would say like
Mhm.
these influencers and our youth got motivated and they just like intensify the exercise and end up being getting injured as
Mhm.
I also mentioned in that WhatsApp status. Even there are, I think,
Like
tons of institute. Yeah, there are abundant of
in a
these
nutshell,
cases.
they are trying to show off those things which they are not capable, not.
Definitely, yeah. And
Mhm.
just if you are uh, showing something just to gain followers on Instagram, definitely you will take the benefit. And you are earning money. But if you are doing something just to show off around people around the gym and you are not actually earning something and you don't have enough knowledge and you are just trying to imitate them what you saw, so definitely you should consider that the case the cost you are going to pay, so it's not like worth of the biceps and the muscles you are going to make. Yeah.
Mhm. Exactly.
So
As we generally see, I'm having one more question like this one.
yeah,
Uh,
please, bro.
like tell me about influencer, which you can say mostly, I can say like mostly everybody person like follow that one person, like mostly, and he's so famous all around the world, and he's getting more and more famous now by leaps and bounds.
If you talk about influencers, I would say like in India there is one named Flying Beast and Guru Man Fitness and
One
yeah,
more thing uh, these are minuscule, tiny comparing to that one. He's, you can
yeah.
say, incredible. Like no comparison. We can't do even comparison with that one person. I'm talking about that one person, and he's, you can say, one more hint I'm giving you. He's in a Hollywood actress.
Okay, you're talking about um, the Rock. What's
Yeah,
his original
exactly.
name? Yeah,
Dwayne
I just
Johnson.
yeah, Devon Johnson, exactly. Yeah,
Hmm.
yeah, exactly. A good actor, social media
Yeah,
influencer. Yeah. So, and
yeah,
he's a big name. Like,
exactly. He's so famous in this industry, Hollywood.
yeah, it did like a lot of hard work. There is a
Hmm.
years of hard work behind his like success.
Exactly.
We
And
don't see.
even. Mhm.
Yeah, yeah,
And
please.
we can see, like his face like shows like hard work, like his face is so bright, like shows hard work, how much he has a hard work like done in his life, and he's still doing.
Yeah, definitely, bro. Years of hard work, and then he achieved this much, and it couldn't be achieved in a matter of 1 year, 2 year. Like, there's a lot of like sacrifices he did to reach
Mhm.
there. Yeah.
He started his career from WWE, and now you can imagine, like his main thing is become side hustle. Now he's not coming in WWE for such a long time.
Yeah, exactly. Yeah, he has a great career ahead even today. Like, he still has muscle mass. Even he's in like, I think he's in 50s right now.
Maybe more than that, something like that. Yeah, he's
Yeah,
yeah, but he's not getting, you know what we say, he's the perfect example of that thing. You know, some people become not good after like getting old age, but he's becoming more and more beautiful after getting old. Like as much as he get older, he's becoming more beautiful, more handsome.
Yeah, indeed, it is true. I support you must have seen his earlier photos and videos, and you if you just watch his current movies, latest movies, you see like there's a lot of development, improvement in him.
Yeah, exactly. He's still
Yeah,
gaining a lot of things.
yeah, exactly, bro. Absolutely right.
And the best thing about his, you know, he's always like down to earth, and he has great oratory skills. As being, you can say, in that different field, he has, I can say, master of like oratory skills.
Yeah, definitely, bro. Mm,
Uh,
we
have
can't
you ever,
doubt it.
yeah, have you ever listened his speech? Like when he's speaking, everybody, you can say, become engrossed completely when he's speaking.
Yeah, definitely. He also speak motivational speeches, and he was invited on many shows, popular shows, American shows. So yeah, we just also heard his few speeches. Yeah,
Exactly. He's a completely determined person.
definitely, definitely.
I'm
There's
having one
many few person.
I'm having one statement for you related
Yeah,
to
bro.
that one article which I had sent you.
Yeah,
Uh,
bro.
Statement is that the future of healthcare technology is already in your pocket.
Future
What
of health and Mhm.
what do you make of this statement?
Yeah. So it signifies like a thing like we have been using Google and to determine about our health. So
Hmm.
we see like we use only mobile phone and we conclude that we having that much or this illness and this doctor we are going to see or whatever, like we become our own doctor. So this
Mhm.
is the I think this is a problem, I would say. The health technology is in our pocket, and we become doctor of ourselves without any proper knowledge of medical
Yeah.
health and whatever, like our body anatomy, physical. There's many things to study.
Mhm.
So
Eh,
yeah, Google show us only a little, and but what we have gone through when we were in medical school was
mhm.
a kind of it really hurts when we have to study like for 7 8 hours and same books and same subjects. Yeah,
Oh, that is really hard paying attention thing to do every single day.
definitely. So hard work is you know is another thing, and Google is another thing, I would say. And
Exactly. Actually, Google have everything, but it depends on what we are searching. We are not mastering, like how we are consuming that thing. That's matter. Google is not wrong, not at all. Like it depends on what we are consuming from it.
yeah,
Yeah.
definitely, exactly. We can't conclude if we are not qualified as a medical practitioner or whatever. Like are we can't make diagnosis.
Uh,
So
Yeah, like just suppose some people use for like symptom and these things. Like some it is really good way to get to know about symptoms and generally like disease. It is really good. About in COVID time, we are just getting updated from like new symptoms of COVID-19 because this is a mutation virus. Like it's get mutated like time by time. So we just get to know about like through Google. Google gives us a lot of information. Like in this virus, there will be new symptoms, these type of. So you have to be aware, be aware, and to get checked yourself. But every time it's not possible. Like to all the things believe on Google. For some things, only doctor can tell us.
definitely, yeah, absolutely. You can say like Google is helpful at many things, as you mentioned, COVID information. But if we have to know, we have to identify which source of information is authentic and which is not. And definitely, it's a great thing. While we are having lot of sources of information, we must know which
Yeah,
one is
we have to be careful about, you can say, fact and legitimate, like that one fact is not.
definitely, bro. Yeah,
Yeah. Would you like to ask me this one same question? I'm having a
yeah,
lot
bro.
of experience. Uh,
Yeah, bro.
smartphone helped me a lot. Like I have been not that much good from last 6 months, and nowadays, like most of things, I did with the help of this smartphone. And as you know about teleconsultation, nowadays this
Yeah,
thing is booming up, like trending. In COVID,
exactly.
that thing emerged. In COVID, that thing emerged, and that become a in essential part now to do this. Yeah.
Yeah, absolutely.
So
Teleconsultation.
yeah, teleconsultation, and they charge the same money, like not less, like same money.
Yeah, definitely. Same money, and you are not physically there, so it matters a
Ex-
lot. Your
And
money also.
and apart from that, this technology help us a lot. Cause when this COVID vaccine come, we have to do registration as well online.
Yeah,
Yeah. And we have to show our, you can say, going somewhere. This if you are going in airport. So at that time, you can just show in your smartphone that one certificate, like vaccine certificate. So that I can say, like this thing, healthcare technology is in your pocket.
yeah, definitely. You can easily get through the security check post by these means. Definitely, it's very convenient.
Yeah.
If you talk about technology in healthcare, yep.
And
And
more than
without,
that, yeah,
yeah, yeah, bro.
more
Technology
than
is playing great role.
yeah, and more than that, we can do, take the insurance, health insurance, easily, just in minutes.
Yeah, definitely.
Yeah.
It is also a good point. Like my health insurance, whatever. Like, if suppose suddenly we come into emergency, and we have to purchase any kind of insurance.
Yeah.
In COVID period, like there are many companies who came up with their policies offering good health covers. So yeah, better option always
And
secure.
one more thing, it's really convenient as well. Like through a one story, I would like to make it clear. Like I did a recently test. So yeah, that test without even asking me, like I didn't ask to like lab, like my report has come or not. They even sent me on my WhatsApp before time. So you can
Mhm.
imagine it is really convenient. And the doctor which has had recommended me that one test asked me to visit the hospital again. And the distance between hospital is more than 100 kilometers. Yeah, from my
Yeah,
area. And if I have to go there, I have to do a cab, and my health is not good as well. The main thing is that.
yeah, I
So
understand.
I just did like call him, but he's saying do the text, and I sent him that one report, and he said like no need to come, no need to come. Your report is okay.
Yeah, that
So you
that's
can
good.
imagine that how much is time like it depends on us, like how we are using technology. It's really a great tool.
Definitely, bro. It's
Yeah,
totally up to us.
yeah,
Negative or positive use of technology, but definitely always be careful using technology, and becoming your own doctor, as I mentioned earlier. Just
exactly. Uh,
take proper.
I would like to make it clear through this statement. I really like it. And don't become your own doctor. Because those who become doctor, they don't become just in some days. In not like that. They don't just do their study through Google. Apart from Google, they do a lot of things. Otherwise, everybody will be doctor.
Yeah.
Once upon a time, what happened? Uh, like our teacher came, like in our classroom, and she said that, like all of you were thinking like that. We are teacher, we are earning a lot amount of money, and what we do, just sit and sometimes stand and just speak and teach you. Uh, but like coming on this stage is really hard. Like for we have to put really great effort to come here on the stage, and after that to teach you. So you can imagine the same thing in any, you can say, any field. It can be lawyer, doctor. We think like that they are earning a lot of money, great life they are living, but on another side, which we can't see, a lot of hard work which they do alone, like which we can't see.
Yeah. This can be related like in a latest research, it has been told like uh,
Hmm.
the medical doctors, the healthcare professionals, including nurses,
Yeah.
dentists, doctors, physiotherapists, whatever, like, different streams of doctors,
Mhm.
could be a surgeon, could be a, uh, you know, cosmetic surgeon, whatever. These will actually leave their profession in future. More and more people from these fields will leave their profession because of the stress they are under facing. Even in the increment of the money they are paid, still doctors are under too much stress, even in other countries as well. uh, because every time there is a chance of emergency and you have to just go and rush towards the patient. Anytime you may receive a call. So a very challenging and a very responsible job.
Oh, and more than that, you have tell me one side which I'm not that much aware. You have or have enlightened, given me insight. Like even after like getting this position, it is not done yet. Service is remaining, so they have
Yeah,
to give
exactly.
the service. And I can say, it depends on their mentality of how they are doing their duty. Because I see some of them are really diligent, like some are really devoted towards their duty.
Yeah, definitely.
Yeah.
Being uh, determinant, just doing your duty with discipline requires a lot of effort, and there's a lot of focus also required. We can't make mistake while we are per- performing treatment, and those difficulty increases manifold when you are working. You are the only doctor in the ICU, and there are many patients under you. So yeah,
Mm,
doctors,
exactly.
becoming a doctors, you could say like it's very important to be positive every time and create a positive atmosphere around you, and always
Mm.
like, even a patient is dying or whatever, like always we should try to just make each other positive inside the our working room. Could be an ICU, could be a simple OPD or whatever, like. Yep.
And doctors are really great because even in these type of situation, they're trying to cheer up their like patient. Always like they're trying to like tell them any type of joke or something to make them like little happy, like to feel better. I see that thing, and in movies as well they see, so these type of thing.
Yeah, exactly. It's very important. You can't see another patient with improper mood, with a bad mood, or still you had, suppose you have seen a patient of like, a bad disease, a very incurable or kind of, dangerous disease, and then another patient appear in front of you, and you were, already thinking about the previous patient, and you are sad, yeah, he's just a child, and he's, how could he overcome. So the impact on the another patient, and you would probably have tendency to make improper or like irrelevant diagnosis. So very important to cheer up
Eh,
mood and to keep it fresh.
that's not the answer to treat every person as same.
Definitely. always be ready for another with a fresh
Mhm.
mind.
You have like ring a bell to my mind for a statement. Like some like familiar, like elder person said to me, if a doctor speaks in a really calm way, positive way, sweet manner, like if that doctor talks to you, like consult you in a really good manner, you're half you are feeling much better there in hospital. Half you are cured. You can consider it. Half is your illness is wipe out.
Exactly. Having positive outlook, even if the doctor haven't given you the exact treatment what you should be given, but still if he talked to you in a good manner, you would feel positivity, and you would feel like a bit uh, a bit burden is lifted from your head, and you still feel better. Always like, and feeling better is very important. Feeling better also increase chances of your recovery. Definitely.
Exactly. It's a great point.
Yeah. So patient and doctor both needs to be positive, and you
Mhm.
shouldn't be negative in any case, in any instant. So
Exactly.
there are Chinese proverbs, to teach you many things, like if you can't run, you should walk, and if you can't walk, you should crawl. You know.
Mhm.
So, but you should always move forward.
Mhm.
Yeah.
The main
You shouldn't stop.
move it like to in
Yeah.
being. That's the
Yeah,
thing.
yeah. The moving, continue moving is the process, and stopping is a death. You can say stopping never going to cure or kind of improve anything. You have to,
Mhm.
the show must go on. Continuous movement is essential.
Yeah, there is a one more thing. Like some say, like if you are feeling tired, like take a rest, but don't quit it. Keep up.
Yeah, exactly. Take rest, take breaks, but
Mhm.
quitting is not an option. Definitely, quitting
Mhm.
never is an option.
Exactly.
You. And how old are you, bro?
What do you think? If you have to make a guess, because we are talking.
You have mentioned 19 in your, like, I've just seen your documents you sent to me. So 19.
Exactly, I am.
Okay, you are 19. Wow,
Yeah.
great. Now what do you think
Mhm.
about me?
Mm, around like 21, 22. That's it. Not more than.
No, bro, I've done degree, like medical degree, and it costed me 5 years. And you could imagine, like, after 18 years, I would have done this degree, and 18, 19, 20, 21, 22.
Mhm.
Even 23, you could still say like 23, but I've done with the degree internship. I am right now 24.
24. But
Yeah.
you look, don't look like 24 cause you look like a boy. Like,
Yeah,
and one more thing, the thing is that like beard gives us maturity, little bit.
definitely. Beard make you look bit
Mhm.
elder than your actual age.
Exactly.
Yeah,
Cause the reason is that we, some people like you can say social impression, we have to do such things, certain rules we have to follow. Like doctors having like same look always, mostly.
definitely.
Yeah.
Yeah,
In some
yeah.
profession, like
I
some like
agree.
profession. But I have experienced one more thing I would like to share with you. Like it's not easy to find a doctor with a beard, isn't it?
It's not easy to find doctor with a beard. I would say, yeah, because in practicals we have been expected to cut the beard and go clean shaved.
Mm-hmm.
Yeah, bro. One thing, a reminder I would like to give you. I got a message that I have used 90% of my data. So, like,
Oh,
yeah, yeah. I think we need to, like, yeah, as soon as possible, because ending is better than
Mhm.
instantly we got
Ex-
disconnection due to
In
the
the
internet.
middle,
Yeah,
yeah, exactly. I really enjoyed to talking with you always.
yeah,
You
bro.
are really
And
a nice person.
thank you, bro, and same to you, bro. I actually enjoyed every time. I enjoyed right now as well. I like talking with you, and I
Mhm.
can't wait. Like in future too, we'll make such calls definitely, bro.
Exactly. At least we can do like once in a week if it is possible. Then we surely do once in a
Yeah,
week.
definitely
And
once in a week.
yeah, as are you master of health, I also like to study like related to health and different type of exercise studies. We can talk about apart from that sometime what I will do. Like we can discuss related to like language also. Like little bit of literature, like new idioms or type kind of things we can also discuss.
Definitely. Yep. Whatever you want to discuss, I'm ready. Always ready, bro. And yeah, it's time to say, bro, goodbye and take care, bro. And we'll
You,
meet again as soon as possible, bro.
yeah, have a sound sleep, have a baby sleep. Thanks a lot,
Yeah,
giving
bro.
your
Bye
precious
bye. Bye bye, bro.